Hello, good morning. My name is Dr. Thonyi. I'm a lecturer from International Medical University. Today, I would like to demonstrate how to interview an obstetric patient and perform examination of a pregnant uterus. First of all, I would like to mention about the purpose of doing antenatal care. Number one, to ensure the well-being of the mother and her baby. Number two, to detect any underlying medical diseases early. Number three, to carry out antenatal screening tests. Number four, to pick up the possible risk factor for the mother and her baby. Number five, to monitor the fetal well-being and fetal growth continuously. Number six, to discuss timing of delivery, mode of delivery, and place of delivery. Number seven, to discuss family planning. Number eight, to encourage exclusive breastfeeding. It is important to be aware that interviewing and examination for fast antenatal checkup take a considerable time. So please do not rush it. Now, the pregnant mother is interviewed by a nurse and all her details are requested and enter a form. The routine tests for fast antenatal checkup are being carried out.
At booking, below are routine antenatal tests done in the clinic. Firstly, patient's weight is taken. Patient's height is also recorded. Blood pressure is measured. Urine for sugar and albumin is tested. Blood is taken for hemoglobin count. Blood is also taken for grouping and rhesus. And another sample of blood is taken for hepatitis B, VDIL, and HIV. For HIV test, patient's consent must be obtained and a pre-test counseling is compulsory. Now I shall introduce Mrs. Joanne to Dr. Thonyi. Mrs. Joanne, shall we?
Hello, good morning, doctor.
Hello, good morning, Mrs. Joanne.
Yes, doctor.
How are you?
I'm all right, doctor. Thank you.
Okay, please have a seat.
Yeah, sure. Thank you, doctor.
I am very glad you have come for your first antenatal checkup. Well, from her record, I see that she is a 29-year-old lady, gravida 3, parity 2+0. That is to say, she is in her third pregnancy and she has had 2 previous live births. Now, she is at 16 weeks of pregnancy. Her blood pressure is 110/70 millimeter mercury. She is 1.6 meter tall. Her weight is 60 kilograms. Urine tests for sugar and proteins are recorded as normal. Now, I shall interview her. Mrs. Joanne,
Yes, doctor.
from your record, this is your third pregnancy.
Yes, it is, doctor.
Was it a planned one?
Yes, it was a planned one, doctor. My husband and I have always wanted a big family.
Well, I also see that you have had 2 other children. Are they both well?
Oh, I have 2 children, doctor. My son, he's 5 years old, and my daughter is 3. They are both well, but they are never quiet.
Well, you know, they are always a handful at that age,
Yes.
aren't they?
Yes, they are, doctor.
Now, can I ask you some questions about this pregnancy first?
Sure.
When was your first day of last menstrual period?
It was on the 14th of August, 2011, doctor.
Are you sure that date?
Yes, I'm sure, doctor, because I wrote it in my small notebook.
Was your last period a normal one?
Yes, it was, doctor.
Well, we normally calculate the due dates by adding 9 months and 7 days to your first day of last menstrual period.
Okay.
So your due date is 21st of May 2012.
All right, doctor.
So you can expect your baby in third week of May 2012.
Okay.
Well, tell me about this pregnancy
Yeah.
and so far, do you have any trouble during this pregnancy?
Oh, I used to feel nauseated, doctor, especially
Yeah.
in the morning.
Mm-hmm.
And there was
Yeah.
this awful taste in my mouth
Yeah.
until I was about 3 months pregnant. But
Yeah.
after that, I felt more comfortable. By the way, my breast feels more sensitive and heavier.
Any of these symptoms are worrying you, or how are they affecting you?
Oh, doctor, I feel very tired and sleepy.
Yeah. Mm-hmm.
It's not easy looking after
Yeah.
kids nowadays.
Yeah.
And I don't have anybody at home to help me with my
Yeah.
household work. My husband, he's busy at the office,
Yeah.
working.
Yeah.
And that's why my
Yeah.
booking visit is a bit late.
Yes. Yes. Well, I'm afraid symptoms like these are very common during pregnancy. Is there anyone to help you at all with your children?
My mother, she lives too far away. But my husband's sister lives nearby. She has offered to help me. Perhaps I should accept her offer.
Now, I would like to ask some specific questions to check that you have no other symptoms
Okay, doctor.
which might be more serious.
Oh, all right.
Did you notice any vaginal bleeding during this pregnancy?
No, no bleeding.
Any watery discharge?
No,
Any abdominal discomfort or pain?
no, doctor.
What about your blood pressure before? Was it a normal one or raised?
It's always been normal.
Do you notice any puffiness face, hands and legs?
No, doctor, no.
Did you notice any changes in weight?
Oh, I'm gaining weight steadily, doctor.
Do you have any trouble in opening your bowels?
No,
Do you have any pain in the chest?
no, no, doctor.
Do you suffer from blurring of visions and headache?
No, nothing like that.
Do you have any difficulties with breathing?
No.
What about your appetite?
Oh, it's good now.
Well, do you have any pain on passing urine?
No pain.
How is your sleep?
I sleep well at night.
Okay, now I would like to ask some questions about your periods.
Okay.
Right? At what age did you see your first period?
I was 13 years old, doctor.
Are your periods regular?
Oh, yes, they are. Every 30 days.
How long do they last?
They last about 6 days.
How many pads or tampons you use a day?
About 3 pads a day, doctor.
Any clots?
No, no clots.
Any pain before, during, and after your period?
No, no pains.
Have you heard about pap smear test?
Oh, yes, doctor. In fact, I did one last year and it was negative.
What about self-breast examination?
Oh, I do that monthly too. So far, it's been all right.
Have you used any form of contraception?
I used to take these pills, doctor, called Marvelon to space my family since my first child.
Were you able to tolerate these pills?
Oh, yes, I was able to tolerate it well, but I stopped, doctor, 6 months ago because my husband and I wanted another baby.
Did your periods return regularly after you stopped taking from pills?
Yes, they did until August, doctor.
Now, I would like to ask some questions about your previous pregnancy.
Sure.
Were your previous births normal ones?
Oh, my son, doctor, he was
Yeah?
difficult.
Yeah.
They had to pull him out using an instrument.
Yeah. When and where was your son born?
My son was born in KL Hospital. It was
Yeah.
in 2006.
Did you remember his birth weight?
Oh, he was 3.3 kilos.
Did you have any trouble after that birth?
What sort of trouble, doctor?
Well, what I mean is, fever, bleeding, and pain.
No, I was all right after that.
What about your second pregnancy?
Oh, my daughter, she was easier.
Yeah.
I had her in
Yeah.
2008, also in KL Hospital. I went into labor and had a normal birth.
How much did she weigh?
Oh, she was heavier, doctor, 3.5 kilos.
Good. Well, did you breastfeed all your babies?
Oh, yes, I breastfed both of them.
How long did you breastfeed?
About 8 months.
Well, now I would like to ask some questions about other things
Okay.
you may have had in the past.
All right.
Have you ever had serious illnesses or operation?
No, doctor. I was admitted for my deliveries, that's all. Other than that, I've always been all right.
Okay, are you on any tablets regularly?
Nothing special. I take my vitamins, folic acid and iron tablets.
Okay, are you allergic to anything you know about?
Nothing that I know of, no.
Well, now I would like to ask about your family.
Okay, doctor.
You said your husband works very hard.
Yes.
How is he? Is he well?
Oh, my husband is well, doctor. He just works overtime to earn some extra money for the family.
The children you said are both well.
Yes.
So what about your parents?
Oh, my parents, they are both well, doctor. My father is 70 and
Yeah.
my mother, she's 68.
Do you have sisters and brothers?
I do. My older brother, he's 35 years old, and I have a younger sister who's 23.
Are they married?
Yes, they are married and they have family of their own.
Well, did you notice any physically or mentally handicapped children in your and your husband's family?
No, doctor. No serious illnesses, no.
What is your husband's occupation?
My husband is a council laborer, doctor.
How much he earns a month?
About 2,000 ringgit a month.
Can I ask you about your lifestyle?
Sure.
Do you smoke or take any alcoholic beverages?
Oh, no, doctor. Neither does my husband.
Please tell me your home condition.
Yes.
Where do you live?
I live here, doctor, in the JKR flats.
Is there water and electricity supply?
There is electricity and I get pipe water, but the place is just too small for my family.
Well, please tell me about your diet. What
Yes.
do you normally eat?
Oh, I normally have rice with leafy vegetables and some fish.
What about meat?
Meat and chicken maybe about 4 times a week.
Do you exercise?
Oh no, doctor, I don't have time for exercise.
Yeah.
The children are so noisy, they're shouting, pulling at things. I'm
yeah.
always busy with them. I don't have time.
Okay. Do you have any hobbies?
No, that too, doctor. No time.
Well, from my interview,
Yes,
all is
doctor.
well,
All right.
and you can expect your baby in third week of May 2012.
Yes, doctor.
I think it will be wiser for you to have him in the hospital.
Oh, doctor, can I have him at home, please? It's so difficult with the other kids.
Well, I know your situation, but your first baby was delivered by instrumented delivery, and now you are at 29, and this is your third pregnancy. You will be better off in the hospital.
I see.
The baby will stand a good chance, and you are also safe.
Oh, okay, doctor.
By the way, may I know your blood group?
It's A positive, doctor.
Thank you very much. Well, I would like to examine you, and I need to look at your tummy, please,
Okay.
to do obstetric examination.
Yeah, sure.
Thank you very much.
Thank you, doctor.